If you have a chronic condition like lower back pain and are looking for relief, Connecticut Disc and Laser Therapy Centers uses a non-surgical approach to care. Dr. James Dalfino is the president and clinic director of Connecticut Disc and Laser Therapy Centers. He's also the author of the book Non-Surgical Solutions for Today's Chronic Conditions. He's back with me today. Doctor, it's always a pleasure to have you here. You brought some new props with you.
I did, Teresa.
Can't wait to get into that. But first, give everyone an overview of Connecticut Disc and Laser Therapy Centers.
Sure. The practice focuses on the treatment, non-surgical treatments of really today's chronic conditions that cannot get the benefits to traditional therapies like physical therapy, medications, and even surgery. So the patients that we tend to see are those that have either tried those methods and it didn't work, or they're looking for something non-invasive to begin with because they're trying to avoid surgical intervention.
Well, let's talk about some of those non-invasive procedures.
Sure. Well, the first one we want to talk about would be non-surgical spinal decompression for lower back pain. Typical chronic lower back pain is caused from a lot of disc disease, and research actually shows that the disc itself has the ability to heal on its own. But the problem is that when patients have chronic lower back pain that doesn't seem to eradicate or get better, and we get MRIs and X-rays, we actually find that these discs are actually getting worse over time.
Okay.
So the problem is why is that happening? The disc actually has the ability to heal on its own, but it's not. So we actually offer a therapy which is called non-surgical decompression, which is actually designed to actually heal the disc itself so that we can get back to an active lifestyle and let the disc heal on its own in the future.
A quicker process than healing on its own, I would assume?
Well, the reality is that most conventional therapies are actually looking at it from a different perspective. They're looking at pain management.
Okay.
They're actually going for surgery, physical therapy, medications, injections, which is not actually fixing the disc. Non-surgical decompression is actually fixing the disc because we're actually reestablishing what's known as a pump mechanism of the disc to get the disc actually healed, bringing water and nutrients in, waste products out. So if we get the disc to actually function again, it can heal on its own.
I see. Doctor, let's take a look at some video that we have here, which will kind of demonstrate exactly what's going on. We're talking about the spinal decompression.
Sure. What we see here is, again, it's a non-invasive, non-surgical treatment. There's no downtime, no contraindications or side effects. What we're actually doing is we can target specific disc injuries. So just like a surgeon would say we need to operate on a certain disc, we can do that non-surgically. And we're seeing as decompression occurs, we're drawing water, oxygen, and nutrients back into the disc, essentially healing the disc. And from this side view, you can see that as the disc expands, below it is the opening where a nerve comes out. And that's why we're able to get pressure off the nerve, and this is why we can help conditions like degenerative disc disease, spinal stenosis, severe and chronic pain, sciatica, pain down the leg.
That made it very clear, actually, the video, once you see it.
Great.
What's the reaction been from patients?
The reaction's actually really well. We have well over a 90% patient improvement rate, and a lot of times when a patient first actually gets on a spinal decompression machine, and it starts to actually do its action, which is a gentle pull, patients look at you like, I'm feeling relief,
like
and they can't believe that that's true, and they don't want to say anything because they don't want to jinx themselves, but they're amazed that they actually can start feeling a change almost instantly.
Wow. Now another option is therapeutic lasers. How does this work?
Therapeutic laser has been around the clinic setting for over 30 years. There's over 6,000 to 7,000 documented studies on its effectiveness. A lot of times in our spinal decompression program, we actually incorporate therapeutic laser with non-surgical decompression. What it actually does, it's healing. And what happens when we shine laser light over an area of injury, so we use an aperture like this and we can shine it over anywhere we want to work on. If we have arthritis of a knee, arthritis in the back, a herniated disc in the back, a shoulder, whatever, the laser light actually, the tissues absorb it, and it actually causes a decrease in inflammation, swelling, and pain. And then it actually improves the circulation to the area so that we're able to heal those tissues.
Now, is this instant as well, or does this happen over time?
Most patients for non-surgical decompression or laser, we can get patients better, within a visit or two, but typically 4 to 6 weeks is an average treatment plan. Okay. What's nice about the therapeutic laser is it all targets the specific areas that we want to work on. So if we look at the screen, we can actually see that we target the specific body that we want to work on, if we want to work on a lower back or a leg or whatnot, and we can actually choose the actual pathological condition. So whether it's arthritis or degeneration or whatever the case might be, a meniscal tear, we can actually target that and work right on that.
All right, and Doctor, you have a special offer for Connecticut-style viewers, don't you?
We do. You know, Connecticut-style viewers, if they want to call for a free evaluation to see if they might be a good candidate for the procedures that we offer, I'd like to offer that for everyone.
I love that. All right, let's put some information up on the screen. If you might want more info about the Connecticut Disc and Laser Therapy Centers located in Shelton, you can call 203-922-9277 or visit ctdisccenters.com. Dr. Dalfino, thank you so much for coming and explaining all that to us.
Thanks very much for having us back.
All right.